Hello, my name is Trent, and I'll be your nurse today. Going to wash my hands real quick. And the doctor has ordered you some medications to control your high blood pressure. Can I get your name and date of birth for safety precautions?
Rolly Davis, 5'6", 97.
Okay, and I'll compare that to your wristband as you say that. And are you allergic to any drugs?
No.
No drugs. Alright, the medication the doctor has ordered you is Metaprolol, and that is to control your high blood pressure once again. It is to be given 2 times daily. You're going to put it in your mouth and swallow it whole. You're not crush it. It's also 50 milligrams. These medications control your high blood pressure. When taking this medication, you do not want to stop it suddenly, because you stop it suddenly it can cause your blood pressure to become worse, or even higher than it was before you start the medication. What you're going to need to check when taking this medication is your heart rate. And to check your heart rate, grab your wrist, and you're going to feel a pulsation there, like a thump in them.
Okay.
And just feel that and watch your clock for a whole minute and count every single thump.
Okay.
If it's less than 60, you don't want to take your medication, and you need to report that to the doctor also. Some other side effects that are expected, but you can try to minimize, is your blood pressure dropping too fast and you feeling dizzy, lightheadedness, or feeling like you're going to pass out or fall down. If that happens when you're sitting in a chair or in a bed, when you get up, that tries to happen, make sure you rise slowly or even dangle your feet before you. This medication may also cause you to feel like your eyesight, or when you look at something, to be blurry.
Okay.
With that making you feel like you seeing blurry and stuff, do not try to drive a car, especially at night, because the dangers of that. This medication may also cause you to feel like you're going to throw up or nauseous. And if this occurs, you can take the medication with meals. That usually helps the feeling of throwing up, feeling like you have to throw up. And some side effects that you need to report to the doctor is if your heart is not beating fast enough, such as when you check it, it's less than 60. You don't take the medication. Once again, you also need to tell your doctor about that. If you notice that, like if you bleed easily or bleed more frequently, or if you have bruising, red, purple on your skin, you need to tell your doctor that also. If it feels like you're hard to breathe, feels like it's hard to breathe, or catch your breath at times, or just trouble breathing, you need to tell your doctor that also, is that some serious adverse effects. Can you teach back to me why you're taking this medication?
For my blood pressure, for my high blood
Yeah, some things that I need you to teach back to me is, how do you check your pulse?
So I'll get my wrist, and then I'll get my fingers and put it on my wrist, and then I'll feel the thumping, and then I count the thumps for a whole minute.
Okay. Also, why are you taking this medication?
For my high blood pressure.
Okay, great. And when would you not take this medication?
If my heart rate was less than 60.
Okay, good. Other things, if you have a side effect of this medication, do you want to stop taking it very suddenly, or?
No,
Okay.
don't stop it suddenly.
Okay. And what's some things you need to report to your doctor?
If my heart rate is less than 60, if I'm feeling shortness of breath,
Okay.
and if I am bleeding easily or bleeding a lot, and like have red and purple bruises all over.
Okay, great. Other things is, let's see. If, what's some expected side effects of this medication?
Blurry vision, so I don't drive at night. Some nausea, and when I get out of bed, I might feel dizzy or something, so I can rise slowly and dangle my feet on the side of the bed.
Okay, great. Do you have any questions about this medication?
No.
Okay, good deal. If you need anything, just let me know. If you have any questions, don't hesitate to ask.
Okay.
All right, thank you.
You're welcome.